This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. And by Lee Health.
Welcome back, Southwest Florida. We're so thrilled to wrap up this show when we get a chance to talk to Dr. Yeneneh Desta. Remember that name. He'll be coming on our show from time to time, educating us on HIV and AIDS. He's with the AIDS HealthCare Foundation, the General Medical Director. Welcome to Lee Pitts Live, man.
Thank you. Thank you for having me.
I'm just thrilled to get you here. I think Ethiopia.
I'm from Ethiopia.
Your
yes.
parents, or you actually got a chance to live in Ethiopia?
My parents are from Ethiopia. They still live there.
You did? You grew up there as a kid?
I grew up there. I went to medical school there and did more studies and training here in the United States.
All right. So the reason I ask you that is because we like to show that international flavor on our show.
Yes.
So this will be the first time we've had somebody here from Ethiopia. We've
you.
had, Kenya and different places in Africa and Egypt. So we got would it be an Ethiopian?
Ethiopian, yes.
All right. You and the work that you guys do over there at the AIDS HealthCare Foundation, that is so vital to our community and the education around that. Tell us, what is AIDS HealthCare Foundation here in Fort Myers?
So AIDS HealthCare Foundation is a big health organization with its base and origin from LA, California. It was established 30 years ago. But at the time it was called AIDS Hospice, Foundation, because people didn't live at the time with HIV. But through time, when HIV medications became more effective, and when the lifespan of HIV patients became basically as same as a non-infected patient, the people within the organization decided to take hospice out of the name and called it AIDS Healthcare Foundation. So it's a big health organization, but it's operations are not only in the United States. We have multiple clinics globally, multiple clinics in Africa, in Asia, also in Latin America.
Is it fair to say that AIDS HealthCare Foundation as an entity is one of the largest entities in the world that educates people and treats people for AIDS and HIV?
Definitely. We are the largest organization.
The largest?
Yes, we have and now we just hit the million mark of people under care. We have 1 million patients all over the world under HIV care.
I see. Now, when you were in med school, you look reasonably young, but when you were in med school at the time, had HIV and AIDS become a household word yet?
Yes, it was. I mean, I remember almost every other patient I was seeing were HIV patients at the time.
Really?
So my training was really mostly HIV, I would say, back in the days. And most likely that's what drew me to the HIV practice also.
Okay, was that here in the States or in Ethiopia?
Back in Ethiopia.
Really?
Yes.
What change have you seen since that time and now? I know you already mentioned that now we know that diagnosed properly at an early age, early stages, you can live a full life just like somebody who has high blood pressure or what have we if you take your meds and get your treatment. Elaborate.
So the biggest changes between then and now is really the treatment. And even within the treatments are now less toxic. It's also less cumbersome for the patients. Back in the days, I remember people were taking 13, 14 pills a day, 2-3 times a day. But now they take 1 pill once a day for the most part, most patients. So because of that, they can't take their medication properly. There won't be something we call pill fatigue. Can you imagine taking 13 pills every day for the rest of your life? I mean, you can't do that. You're gonna fall at one point. So with 1 pill once a day, people are taking every day, and they're living longer. Not only that, these medications are also less toxic. You take them, and you have less side effects from the medication, meaning you're more inclined to take the next dose and the next dose and the next dose.
That's huge advancement in medicine.
It is. It is.
The process of tapping into your services. We have your website and phone number that's appearing on the screen. Who can tap into that? If you suspect that you may have it, or do you just can come by and get a screening just to be on the safe side every year, or what? Kind of elaborate on that.
So we have a division, like a public health division arm of the clinic that does testing every day, from 8 to 5. So if somebody thinks that they are at risk or they have been exposed, or want to know their status, for whatever reason, we have a testing center. And if somebody tests positive, the policy within our organization is, they have to see a doctor or a nurse or a provider within 72 hours. If somebody tests positive today, then they will definitely see me within 72 hours to continue their HIV care.
The privacy of a person after they, let's say they come into your shop or they learn that they're HIV positive or what have we. Tell us about how you protect their privacy.
So we follow, HIPAA guidelines, just like, we protect your privacy in terms of, diabetes diagnosis or high blood pressure diagnosis. It's the same thing, we do protect, their privacy highly. For example, if somebody contacts us from the outside, asking information, we don't divulge that information. Even when somebody walks into the clinic with somebody, I do ask, if that person knows their, status before I divulge anything. Because sometimes the family members may not know. So we're very, very discreet in the way we conduct our business. And we've been here for a long time doing HIV medicine, and we know the small turns and bends where things tend to be wrong. So we do take caution in disclosing patient's status. For example, even if a family member calls on the phone and say, oh, so-and-so was in the clinic today, I just want to find out how the visit went, we wouldn't divulge any information without the person telling us, giving us a permission.
I want to go back to something you said earlier, know your status. That is probably the gateway, the key, right?
This is the gateway to treatment. It's the gateway really to everything HIV. I have a saying that, everybody is HIV positive unless proven otherwise. So it may not be a nice way of saying it, but you have to test yourself. You have to know your status. Otherwise, you can't assume, you are HIV negative. Especially if somebody is sexually active, they have to know their status, no matter what their sexual orientation.
The various stereotypes that we have about we being society in general have had and maybe still have about people who can get HIV and AIDS, gays or intravenous drugs and things of that nature. That crosses all races, genders, incomes. It's just, you can't just look at somebody and know that they're low risk or whatever. You got to really be careful about who you having sex with, actually.
Yeah, the risk factor is unprotected sex. So as long as somebody has unprotected sex, they are potentially exposed themselves, especially if they don't know the HIV status of the other person. But yeah, multiple sexual partners, going on online dating, blind dates, using all these apps, increases the risk. But the bottom line is unprotected sex is the risk factor for HIV.
As people with HIV patients live longer, what should their health focus be?
So because these medications are good and patients are living a long life, so they will develop medical conditions just like anybody. If they are chronic smokers, they can develop COPD, they can develop lung cancer. If they have a sedentary lifestyle, they can develop high blood pressure, diabetes mellitus, and complications from those, osteoarthritis. So they have to focus on their general, health. And we use the term, HIV healthy in HIV world. Even though they have HIV, which is stable now, which is well controlled, but they have to be healthy in the rest of their lifestyle. So they should focus on, what they are eating, their exercise level. And smoking is a big thing within the HIV world. The HIV patient on average smoke more than non-HIV patients. And what's killing most HIV patients these days is, lung cancer, liver cancer, those kinds of things. So
one of the most popular people in society is Magic Johnson in terms of him having the HIV virus. He's gone about living his life. Most people, when he first got the virus, they say, oh, he's wealthy, he's able to get the best medicine, he's able to get the best this and that. And there are some people who say that he's cured now.
He's cured. I'm glad you raised that.
Right. So let's tell, one, would Magic Johnson have access to any more medical medicine or anything fancier than what you guys provide?
I don't know Magic Johnson's personal medical history, but my thinking is he does take the same medication that everybody does. And I'm glad you raised the cure issue in Magic Johnson. I have a lot of especially African American patients coming to me and saying, why can't you cure my HIV because Magic Johnson is cured?
Wow.
And I tell them, and I go to this detailed, history and education of HIV, telling them most likely Magic Johnson takes the same kind of medication that they take. I don't know exactly what he takes, and that basically he's also not cured, but he is in a state where the virus is not detected in the blood, in a state where the virus is not going to attack his immune system, just like the average person. And it's good that we use the Magic Johnson example, especially in certain communities, because some people can't relate to that. But the bottom line is he's not cured. Nobody. There is only one person who is cured from HIV in the whole world. Somebody we call the Berlin patient. It's a long story. Maybe we can talk about it next time. But there is only one person cured. Yes.
That's something to study, right? That's optimism.
It's something to study. So what they did on that Berlin patient, they did repeat on multiple other patients, and it didn't work for other patients. So why that patient got cured is kind of a little bit of a mystery, but there is only one person cured so far.
You mentioned African Americans. I don't know all the stats, but I'm thinking, I've read over the years that that's one of the growing populations, the fastest growing population, people of African descent, and black females in attracting the HIV virus.
I'm glad you talked about the black females. Actually, the black female infection has plateaued because of the interventions taken. Now, within the African American community, we see a lot of new infections, but in men who have sex with men, and in what we call MSMs or gay men, that's where the new infection is happening. And this is true in Fort Myers, it's true in Miami, Fort Lauderdale, or Atlanta. Sometimes I go to Georgia, also to the Atlanta area, to see patients, and that's what is affecting the new African American infection is usually within the gay community.
What is pre-exposure to prophylaxis?
Pre-exposure prophylaxis is, so HIV is still happening, new infections are still happening, so we can't just rely on somebody protecting themselves or another person protecting the community. We want that to happen, but sexual behavior sometimes is difficult to change. So for those people who have a high risk of getting HIV, there is a medication that they can take that can prevent them from getting HIV.
Really?
So yes, before they get exposed, that's what pre means. Pre means before. Before they get exposed, they can take the medication, and if they take the medication every day, it's guaranteed, the medication works usually 98-95% of the time.
How does one get a prescription for that?
They can see me.
You just say, I want this? And
yes.
Get it.
So exactly, they can see me. If they say they want the pre-exposure prophylaxis, I would assume, they are having high-risk behavior, multiple partners, or it may be IV drug use, but for some reason they think, they may get infected, or they may live, with an HIV positive person who may not be taking medication properly. That may be, their life partner. So if they come see me, we usually give them medication.
Okay. Now, cost. Is there a safeguard in place for people who can't afford these medications or afford to come see you? The treatment, is it cost associated there?
HIV medication or pre-exposure?
Just as it relates to HIV and AIDS.
Yeah.
At your office, if they don't have the money, go.
If they don't have the money, they can see me for free. Meaning,
That's what
we don't charge them, a doctor's fee for seeing me. And if they don't have the money, there is a state program called ADAP, the AIDS Drug Assistance Program. We will sign them up for that. As long as they make X amount of money. I don't remember off the top of my head, but it's a generous amount that they have to make to qualify for that program.
That's really good to hear. So income should not be a barrier to getting healthcare treatment as it relates to HIV.
It shouldn't be a barrier.
Right.
And so most patients think, I don't have any money, so how do I get my medication? But there is a program already laid, that they can access.
Now individuals can test themselves in the privacy of their home?
So actually, this has been going on for a few years, so I don't think most people know it, but there is a kit that they can buy from CVS or Walgreens, and they can test themselves and find out the result for themselves.
Just like a pregnancy test.
Just like a pregnancy test.
Wow.
The only caveat is, once they have that positive test, they have to say doctor. They have to have what we call the confirmatory test and go from there.
How soon after you have the virus should you get onto treatment?
As soon as possible.
ASAP.
If somebody, in fact, we have something called test and treat. If somebody tests positive today, we would like to put them on treatment today. If not, within the next few days. So as soon as possible. So in the past, we used to wait until the immune function declined, but that's no longer the thinking or the teaching or the practice. So the sooner the better.
So if they call that number that they've been seeing on the screen, go ahead and give that website. Say it verbally for radio purposes.
www.aidshealthcare.org.
And also 239-210.
9980.
Okay. Well, Doctor, it's been a pleasure having you on the show and look forward to getting you back.
Thank you.
Keep up the good work. As the saying goes on this particular show, for those who say it can't be done, they're usually interrupted by those like Dr. Yen and all the fine people who are associated with the AIDS Healthcare Foundation who are doing it. We'll see you next week. Hi, everybody. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts, the host of Lee Pitts Live. We're here at the Holiday Inn Airport in Fort Myers, and I want you to continue to watch Lee Pitts Live on television, on YouTube, and of course, listen to us on radio. But to get all of your shows to come right to you, just click on that subscribe button right there, and Lee Pitts Live will come right to you, your time, your way. That's Lee Pitts Live.